Hello everyone, today we'll be studying about the Herbst appliances. So, Herbst appliance is a fixed functional appliance that was developed by Emil Herbst in early 90s. It was introduced by the dental profession at the International Dental Congress in Berlin in 1905. This appliance was soon forgotten and was reintroduced in the year 1979 by Hans Pankers, who popularized it to use. So let's talk about the indication. First of all, the indication is the Herbst appliance is indicated in correction of class 2 malocclusion due to retrognathic mandible. They can be used as anterior repositioning splint in patients having the TMJ disorders. Now, the specific indication includes the post-adolescent patients, as the Herbst may be completed within 6 to 8 months. Thus, it is possible to use the residual growth left in these patients. Now, the next is mouth breathers. The Herbst appliances can be used in the mouth breathers unlike other removable functional appliances. The uncooperative patient. It is a fixed appliance and is worn 24 hours a day. Hence, we know that they cannot remove it by their own will. Hence, the continuous force is applied. Hence, it is used in the uncooperative patients. So let's talk about the types. The types of the Herbst appliances is banded Herbst appliance and bonded Herbst appliance. The banded Herbst appliance. Here the upper and the lower first premolars and first molars are banded. The tubes are fixed to pivots soldered to the distobuccal aspect of first molar bands. The shaft or rod are fixed to pivots soldered to the lower first premolar bands. Here in the bonded Herbst, the wire is reinforced. Here the wires are reinforced by the acrylic splint that covers the occlusal and the part of buccal and lingual surfaces of all the teeth except the anteriors. The pivots are fixed to the wire framework at the distobuccal aspect of upper first molars and mesial aspect of the lower first premolars. The tube is fitted into the pivots in the maxillary molar area, while the shaft is fixed to pivots in the mandibular premolar region. Let's see the picture. So this is the picture of Herbst appliance. Okay, so this is the side view, B is the plunger and the tube, and C is the maxillary occlusal view, and D is the mandibular occlusal view. So let's talk about what are the treatment effects. So the treatment effects are the first is the class 1 molar relation or over corrected class 1 molar relation. 2 is there is an increase in the mandibular growth. Similarly, there is a certain amount of the distal drifting of the maxillary molars that helps in the correction of molar relation. Now, there is overset reduction by increase in the mandibular length and proclination of the mandibular incisors. Next is it has an inhibitory influence of the sagittal maxillary growth. As we know, class 2 is because of either retrognathic mandible or prognathic maxilla, right? So here it helps in inhibitory influence of the sagittal maxillary growth. Hence, in this way also the class 2 is corrected. Similarly, it helps in anterior transformation of the glenoid fossa. Now there is also it increases the S and B angle and decreases the S and A angle, SNA and SNB. Similarly, what are the advantages? The advantages includes as it is a fixed functional appliances that it is not removed by the patient. Hence, the continuous force is applied. The next is the treatment duration is short due to the continuous nature of the action. Similarly, the less patient cooperation is needed as it is a fixed appliance. Similarly, it can be used successfully in the patients who are at the end of the growth phase, as we learned it earlier in the post-adolescent patients, because it is possible to use the residual growth left in the patient as only lesser time is taken, 6 to 8 months, right? Similarly, now the less patient cooperation is needed and it is fixed appliances. Similarly, it can be used successfully in the patients who are at the end of the growth phase. The Herbst appliances can be used in the patient who have mouth breathing habit due to the nasal airway obstruction. So there are some of the disadvantages, like there may be uh, like the other functional appliances, it requires the patient cooperation as the initial discomfort is usually present. Similarly, it can cause the minor functional disturbances in the masticatory system, which are the temporary and gradually they will disappear. Okay, there is increase in the risk of development of the dual bite, with the dysfunction symptoms of the TMJ as a possible consequence. Now, repeated breakage and the loosening of the appliances occur especially in the lower premolar area. Now, next is the plaque accumulation and enamel decalcification occur especially in the splint type of the appliance. Now, sixth is the tendency of the posterior open bite at the termination of